2 of our series on standing up for social justice, racism, and inequality in psychology training. And today's session is really going to be focused on a call to action and some of the things that we might be able to do within our training programs. Next slide, please. We are on a Zoom call rather than a webinar, so everyone can participate. Please mute yourself unless you are speaking. If you use the speaker view instead of the gallery view, you can just focus on the speaker. We will be using the chat box for questions and comments and transcribing some of the suggestions that come up, and we will make the chat available to everyone who participated after the event. You may also use the raise your hand feature, although sometimes we might not see that. So if you have a question that you'd like to discuss, it might be more helpful to put it in the chat. Our goal is really to facilitate dialogue among our members. When we started today, we were reflecting on the content that we had planned, and we all noticed that we were feeling a little bit anxious as we were thinking about where to start, and reminded ourselves that it is okay to feel anxious because it's really big and really overwhelming and really important. And it is perhaps one of those times where anxiety is motivating and adaptive. So in the interest of being inclusive of everyone, we ask that you limit your comments to no more than a minute at a time. And we are recording the call, which will be on our website and available for review again in the future. Thanks, Jeff. I'd like to introduce our APPIC moderators. I'll start with myself, even though my name is last. I'm Shona Vaz. I'm the APPIC secretary on the board of directors, and I am at the University of Chicago Medical Center and the training director for the internship and the fellowship programs there.
And I am Allison Osfed, and I'm currently serving as vice chair on the APPIC board of directors. My day job is with Veterans Affairs, and I work at VA Pacific Islands healthcare system currently. I'm involved in training, but no longer serve as a training director myself, though I have in the past at 2 different VA facilities. And we are joined by our executive director.
Hi, everyone. I'm Jeff Baker, Executive Director for APPIC. Also have a clinical appointment at the University of Texas Medical Branch, where I see patients there in the anesthesiology clinic there. Was the training director for a little over 20 years or so at our internship and our postdoc program, and very happy to be here today to talk a little bit about this very important topic, and look forward to some great interaction among the participants. I wanted to make note that Dr. Davis and Dr. Mendoza-Newman are going to be trying to join us as possible. I'm not sure if they're on right now, but I'm pretty sure they're going to pop in and say a few words or interact with us. Okay.
All right. So I would just like to focus us in getting started in solidarity, and note that APPIC stands with our Black, Indigenous colleagues and trainees of color, and against systemic and institutionalized racism and oppression. And we as an organization are committed to exploring our own privilege and respecting the diversity and identity of all of our stakeholders. And today, we really wanted to focus our time in this call in terms of how we can stand up and take actions. So we really want the focus today to be thinking about how do we address the impact of current events on our training programs, and even more broadly than that, how do we start thinking at a systems level? You know, how do we dismantle centuries of racism and oppression, and what are the steps that we can take? And I think, you know, to Dr. Voss's earlier comment, it makes us feel anxious to think about that because it's
Listen, we're losing you.
so big and also so important. And so if you're feeling that way, I know as a nation. And so
Allison said she might be having a few IT problems there, so we want to make sure
I'm really looking. All right, Jeff. Oh. So next slide.
Okay. Want to welcome Dr. Davis to the presentation as well.
Great. So in terms of the structure of our call, I'll share that and then turn it over to Dr. Davis to say hello. And then from there, we'll launch into our discussion. So as usual, for anyone who has joined one of our community calls, you'll note a similar format here today. We've organized our questions into broad categories, and it's our role as the moderators to help facilitate a discussion about each category. And we encourage participation and really want to hear from you. You all have good ideas about how we can take action and how you've already taken action that we all can learn from. So we really want people to speak up, whether it be verbally or in chat. We know we have a slightly smaller group on the call today than we've had in the past, so I hope that will help quieter folks who have things to say feel more comfortable saying them today. In the interest of time, though, we may need to cut off the conversation in order to move to another issue. If this happens, it is not personal. Please do not be offended. We just want to cover all the topics and give everybody the opportunity to participate as best we can. And then finally, we just want to point out that this is a space that's intended to be one of mutual respect and courtesy towards one another and openness to the diverse perspectives and experiences of others. And so we want to hold that as we move forward in our conversation today. And Dr. Davis, did you want to say hello?
Good afternoon. I'm Clady Davis, the current chair, and I'm joining a little late, so apologies, but happy to be here with y'all. Thank you, Allison.
Thank you for being here. We're so delighted to have you. So I will get us going. I know my internet connectivity is not the best, so I will launch the question and then hopefully other people will chime in. But the first question for our discussion today is, since you know, things have evolved, we asked a similar question when we met last time, and I think more time has passed and we've probably all identified more things that we want to address at the lower level and at the higher systems level. So we're curious, what issues have you identified in your training program as being important to review from a social justice perspective? And with that too, maybe what are some of the ideas for change related to those if you have them? So what have people observed? What's being targeted in your home programs?
Hello, everyone. I want to talk about two things. Number one, working in a primary care clinic, you have different groups of people, and what I have found that our training program is the most diverse group within the organization, which is fantastic, but at the same time, it's very challenging when we are interacting with other disciplines that are not as diverse. So I think that one thing to think about is that when we are working with, you know, in different systems, it will be good to understand the perceptions of other groups in terms of diversity, but because they may not be as diverse as our groups. The other thing is thinking that diversity, inclusions, social justice issues are only discussed one day in just one training, and this needs to be embedded in every type of conversation. If we're training on provision of supervision, or we are talking about anything, you know, that perspective needs to be there. And I think that what I have seen is that, okay, if we talk about diversity today, check, we cover that. So that's another thing that I feel that we need to bring more and see how we can actually have a good plan to integrate these discussions throughout the training.
I really appreciate those comments. I think they're so important. You know, what happens when we're the most diverse group in our institution, our training programs, and what does that mean? And what do we, you know, how do we capitalize on that to move the institution along in some ways, right? That's something that we've been talking about quite a bit at my institution, and thinking about, okay, you know, we're doing all these things for psychology training, you know, but the whole facility, our whole healthcare system could benefit from these diversity dialogues, and thinking through the way that we are, what needs to change, and how do we get everybody at the table and engaged in that process. It's just one thing that your comments made me think of, as well as the idea that somehow such a discussion happening one time only allows you to check the box, and I completely agree. It needs to be embedded into all that we do. And recently we had a discussion about the idea of multicultural orientation versus competency, and how the orientation kind of connotes a worldview and a process that's always ongoing, versus a competency is like you could achieve it and then be done. And I think it is ongoing. So I really appreciate those comments. I'm curious if other folks have similar ideas or other ideas that you've observed in your programs.
I'm willing to put out a lessons learned if people, to be more responsive, and apparently to give space, like to actually structure the space. So in our program, during the Black Lives Matters movement, I sent out a couple of emails asking if the group wanted to meet. So we already have a diversity advancement group. It was the end of the internship when this happened, and we did not have a meeting for that month. And so I did a passive email of asking for people if they would like to meet. No one ever did. And we're at the end of the June, and we did have a kind of a debrief meeting where lots of people said they felt like we should have just had the meeting versus being asked to have the meeting. So as tomorrow starts the new orientation, I am literally going to start with the new course of building in the space and just have it as a requirement. The thing that they were saying is that they felt this power differential that, of course, I have tried as a training director to break down and say, I want to treat you like junior colleagues. I want you to feel approachable, that you could approach me and tell me things. And so I thought the email communication was sufficient, but it was not, is what I'm hearing. So my lessons learned have been just build the space and hold it there so that there isn't this awkwardness and trying to diminish the power differential that our trainees might be feeling. I wish I had done it differently. I have some regrets.
Thank you for sharing that. I think it, you know, is so important. And I mean, I think that's part of what we were talking about earlier as we were feeling nervous in facilitating this discussion today. Like, there's so many ways where it feels like, you know, I can make an error, and really it's an opportunity to learn and grow and do better. And so thank you for sharing that so we can all benefit from it too. And I think you're right on that. Just build it in. Yeah. Other lessons learned or observations about what needs dismantled or rebuilt, or how you might rebuild things, the training program level or beyond? Yeah.
I was thinking of something you said earlier. You said diversity is a competency, and I heard this from my trainees in their exit interview. Diversity is a competency, not a specialty. And sometimes we forget that. And I think that this goes to the burden for diversity competence sometimes resting on the shoulders of people of color. And someone else put this in the chat, moving away from one person being responsible for all of this work is really important, and a commitment that needs to come, I think, from across the program and within the larger context.
I think that's such an important point, Shona. I wonder if other people have ideas or recommendations about how do we make that shift, when oftentimes it is true that there are certain people that become the diversity people, whether by nature of their identities or their interests or other things, and then it rests on them. And too often it's a burden on people who are, representing marginalized groups. And it really is everybody's responsibility, and it's not a specialty like you're saying. And I'm just curious for folks who have had some of that sea change where it becomes a responsibility of the whole, what has worked to do that. I can share one thing that I've observed in my current system, which is that leadership engages. So when we have the grassroots and then also the top down, and I think that that's been one piece for us that's been helpful. We've not arrived, but that's been part of our process.
Jump in if you can hear me. Okay, I'm having some technical difficulties. This is Lori Schlepper. Am I coming through?
I'm trying to speak.
I heard someone very faintly speaking, and I'm not sure if
Me too.
their microphone's working. I did want to welcome Dr. Mendoza-Newman, another APPIC board chair. I know she's having lunch right now, but thanks for joining, Dr. Mendoza-Newman.
Hello, everybody. Nice to be here. I'm just, joining, and I am in the middle of eating lunch, so pardon me. I think I'll be recorded eating lunch, so yikes.
Just mute. Any other reflections on this first question?
There's a couple in the chat there from Dr. Bolton there had some good ideas there about a monthly staff meeting where everyone attends and changes the focus and addresses specific issues in their model.
I think that's great. And
Pardon me.
Go ahead.
Allison, I'll just add, we've been at this for a while. I shared some things last time, and it came from the perspective of we had the trainees reading the book White Fragility. So I'm curious, how do you integrate reading and exploration of these issues into the curriculum for the trainees, but then also parallel, what are the staff doing? So out of that, we realized, gosh, we should be reading this book too. And so that's something we've been doing. Also shared there's a podcast, 1619, that talks about the history of slavery in this country. And that was really helpful to reflect on. So out of that, the staff are doing the work as well. And what we've done is we've separated the staff from the trainees just because of the nature of some of this. But the goal is to get staff ultimately up and running, so to speak, so that they can begin to incorporate these. And so we're having a lot more discussions in our meetings about who holds the power, who's talking more, why, how to invite in some discussion. So it really takes, I think, a lot of introduction into a system. You have to have buy-in from higher up for sure. And then that the higher ups, those with power, are actually doing the work to incorporate it more into the curriculum and the everyday operations of the organization. So even like, how do we hire? Who do we hire? How do we make decisions? All of it. And I mean, I feel like I'm saying it very globally, but there are some, I think, concrete steps to start at, and it does start at the top. So what kinds of conversations should you have with your directors and supervisors?
Thank you. I think those comments are really important, and there's so much in there that we all can be thinking about, like, how do we do this, and again, it's getting that buy-in, grassroots and top down, and thinking about, right, who has a seat at the table because of our hiring practices, and how do we change them so that we can really, include diverse voices. Yep, I think it's super important.
Some additional great ideas.
Oh, thank
brought
you.
up in the chat, sorry.
No, it's okay. I was just going to say, I think my time is up for the first topic, so I will step back and ask for the next slide and the next moderator.
Dr. Shepler was trying to say something. I don't know if you have anything to add to that question. Our next issue is really closely connected to what we're talking about, and that is what changes are feasible for you to implement in your program and at your site. I can get us going with, sort of is the time of year to take stock and think about what we did and how we're moving forward. And I had my exit interview with my interns yesterday and was surprised to hear them actually ask for more time for discussions about diversity. We have a monthly seminar and they had many seminars. And they prefaced it by saying that they thought was such an important topic that they were actually asking for an additional monthly meeting to address diversity issues and to have a mix of both content. The addressing model was something that was raised that we haven't previously covered explicitly, but we will be doing that. And then also combining it with case discussions and thinking about what our roles are as we try and promote equity and inclusion for both our staff and for our patients. Does anyone else have ideas about changes that they're planning to make for the upcoming year?
Just click that little unmute button there.
I'm willing to put out the list that we have come up with so far. It's a work in progress, so it involves both COVID as well as Black Lives Matter and social justice movement. We already have an existing diversity advancement committee that we've had for long-standing that meets monthly. One of the things that we had done was we had put it at the end of the day, so literally after a very long Thursday after didactics, and they've already had a full day. Our meetings were from 5 to 6. Because it was the best time that we could get everyone together. But we heard from them they actually wanted to incorporate it into their workday in order to provide the significance that, again, diversity isn't an extra, diversity is part of who we are and what we do. So we've immediately moved it into a regular scheduled workday meeting that will happen once a month. We have a didactics committee, and so where we ask about diversity, but we're gonna increase those questions to be about diversity, social justice, expanding more along the lines where we ask, and that's an assessment that happens that every didactic speaker is asked. And we also send the didactic speakers tips around ways that they can incorporate these things into their didactics. So we're gonna update that document to include more around social justice. We have a steering committee where we have a representative from a member of the cohort. We are now going to add them at the beginning of the meeting. They've traditionally been at the end. We're going to add them at the beginning of the meeting, and we have specifically both questions around what is the program currently doing around social justice, and are there any concerns that the resident needs to bring to us so that we are being more responsive to their questions. This last couple of years, we've created a stewardship meeting where they actually get together. It's more like a processing group where it's being led by a member of the faculty, but not a member of the training faculty. So they actually can have a space to talk amongst themselves around experiences and issues, again, to try to talk about that power differential or dynamic so they can have spaces to do that. And so those are just some of the ideas that we came up with as faculty recently in responding to this last movement, and then the ideas that we're going to keep moving this forward every month that we meet to have these discussions. So an ongoing thing.
I really love the idea about giving feedback to seminar leaders and guest speakers about how they can incorporate issues of diversity and social justice into their lecture. I'm wondering if you would be willing to share that handout with us. And I would be happy to facilitate uploading it to the APPIC website.
Sure, I'll do that.
You can just email it to me at the end of the...
I'll send you the version we have now, and we are clearly going to update it again to be more social justice focused as well. So I'll give you both versions. I'll send you the one that we eventually update to, but I'll give you the one that we've been using right now just to get people started.
The changes people are hoping to make in this next year? My department is starting a new diversity committee, and based on recent events, we're really sort of reconsidering the role and the goals of the committee and whether we need to arrange for more opportunities for the department as a team to engage in more activism and steps towards taking action. I'm wondering if others have diversity surveys or committees that have specific goals that are focused on change.
This is Clady. At Cal, we do have a diversity committee, although that I'm not sure how helpful that is with regards to the training staff. But I do think one of the things we are going to try, I guess I should say we, what I'm going to try to do more is have our leadership team, both in the accounting service, but also the health service, going to do more modeling. I think our interns and fellows are very invested in these topics, but don't see the senior leadership, which I guess we were talking about in the previous question, also kind of walking the walk. And Mary referenced her folks, her training staff reading White Fragility. Our leadership team is reading White Fragility. And I think our interns and fellows almost like were jumping up for joy when they heard that. And I think we need more of that kind of work happening at the senior, because then I think it'll trickle down. We're also going to do oppression analysis of kind of what's happening in the health service. So like, how do our hiring practice support or not anti-Blackness? How are we confronting it? And so for me, I think the changes are going to be at the senior level, and I think that will ultimately positively impact the training program, which I think is doing some good work. I feel like our interns and fellows often are doing more than our senior staff. And so, but it's the senior leadership I think we need more work with.
I really love that idea of it coming down from senior leadership. Our chair sent out an email last week with an essay on white privilege and the importance of everybody reading that and being prepared for our next town hall. And I was able to send that onto our new trainees, which I thought sent such a good message about the department's view on being open to addressing some of these issues.
Some additional really good ideas in the chat here. Having medical staff learn more about professional development of interns and postdocs, and putting it together a newsletter and sending that around to your colleagues. Discussing racial issues with clients and staff. Those are touchy subjects in some areas. I'm in Texas, and that can be somewhat difficult, but it's important to do this and to lay it out. I think this is a great time for social change, and we should take this opportunity to help out trainees and the public.
Other thoughts or ideas? One of the issues that has come up for us that is really such a systemic problem is health disparities and the patients that we serve. So for example, in my department, we actually have a Medicaid cap of how many Medicaid patients we're able to see. And we're on the south side of Chicago. And what that does is it shuts out so many patients from being able to access mental health care. Many of our trainees are mandated to see more health insurance, patients with health insurance, because we have contracts for our employees. And so bringing this to the attention of institutional leadership and then sort of juxtaposing the reality with our intentions has been something that is a little bit of a thorny issue. So I'm wondering if other programs have noticed issues related to disparities in this manner.
I can say that I don't know the data. I mean, the Veterans Affairs is a little bit different in who's eligible for our services, but one of the things we've been talking about locally is creating a specific health disparities rotation. And some of this comes from actually ideas that have been expressed here that are happening at other training sites. So this is not a unique idea to us, but one of the aspects of it that we've been considering is reviewing our data to look at underserved patients and how well we're serving them and if we're serving them, and that would be built into the rotation that we analyze and provide that feedback to upper leadership and then make changes. So assess, share, and then plan, and that would be part of the training experience. And we hope that it could affect institutional level change then too. So that's one idea.
You asked about changes. Hello, everyone. I'm Lydia from Palo Alto. And at our private nonprofit clinic, we just were informed about a cut in our Medi-Cal contract. Our doctoral interns see Medi-Cal children, teens, and families. And historically, we've had a robust Medi-Cal contract with Santa Clara County to see these families, which are, quite diverse, and it's been wonderful training for interns. But we just received a cut from Medi-Cal, and I understand that other clinics in Santa Clara received cuts as well. And so I don't know if it's across California, if it's across the United States, or how specific it is to this Santa Clara County. But it's really tragic, because at a time when families are so affected by COVID and the aftermath of COVID and all of these painful social issues that have been highlighted in recent months. So there's so much more social suffering, and so to receive a cut in the ability to serve basically the underserved, it's just tragic.
Mm-hmm. Mm-hmm.
Thank you. That is such a great point. And we're wondering, a comment question from the chat also is whether anyone has resources for addressing health disparities that we might be able to integrate into some of our training experiences, which is a nice segue to our next question, which I will turn over to Dr. Baker.
Yes, what didactic and experiential training could be offered at your site to reflect taking action for social justice and against racism and oppression? So we've had lots of good chat on many of these kinds of things here, and I want to make sure that everybody is looking at the chat. But at the end of this, we will have the recording as well as the chat discussion on the APPIC website. It'll take a couple days, but it will be there. But if you have some additional ideas or want to emphasize a couple things here, everyone has put in some great ideas here, and there's been a couple questions here about how do you address these health disparities and how do you confront this, or how do you do this at your site? I can remember when I was training director, I used to have my psychology interns go to the emergency room and sit there on a Friday or a Saturday night for about 4 or 5 hours between 10 p.m. and 2 a.m. and just see the folks that they have to, that need this emergency care, and build some sensitivity, hopefully, in responding to patients who don't have access to health care typically, or at least at our university it wasn't. It's a huge culture change, culture shift at my university. When I started here many decades ago, it was 85% underserved, underfunded, unsupported population, and they did what every other medical center in the country did. You did a shift and started doing what Shona's University did at Chicago to put a cap on unfunded patients, as well as Medicaid patients, although Medicaid is still considered golden here at our university. It's the unfunded patients that have a cap, but it's so disheartening when you know patients could really use that kind of service. And so our psychology trainees, I wanted to make sure that I increased their level of sensitivity to underserved populations. We always look for that in the applications for sure, but we also wanted to give them opportunities to be exposed to different experiences while at the university or during their training program. And hopefully many of them, actually there's a few of them on this chat today, so I'm glad to see them.
Hi, I'll add a few things that that we do at Stanford. One is we do have a social justice outreach seminar that meets throughout the year, learning about reading literature on social justice concepts, and then later in the year, they are required to do a social justice outreach project. And so we have a number of community centers for students of any range of identities. And so the goal is to do a needs assessment and then carry out a project, and they report that to the staff at a staff meeting. The other thing is we have what we call a GSI rotation. It's gender and sexual identity. And it's all about gender sexual identity issues, and the trainees at the end of that are also required to do what we call a queering project. And so they take any concept that is traditionally aligned in the binary and then queer it up. And so I collect those as well, and they've done some really wonderful things. And then the last thing is something that's on our list is to do an internal review of our policies and protocols to ensure that they're to ensure that we attend to and change any of the anti-racist practices and policies on our unit as well.
Mary, there's a follow-up question about whether you'd be willing to provide some examples of social justice projects.
Sure. So an example, this year, sadly, they were canceled because of COVID. So they weren't able to carry these out because they were all supposed to be in-person projects. So we gave them other projects to do. We had a diversity book club, for example. They read that. Last year, we had a request at the med school for more diversity focused care for their medical students. And so one of our interns actually did a needs assessment, provided what we call community connects. Those are drop-in hours for the medical students. And out of that, then she produced some statistics and shared that with staff. Out of that actually came a position. Someone was hired to do that job. She was full every week seeing students, medical students of color. A very similar process happened at the law school as well. A couple years ago, there were students who were experiencing racism at the law school, and they were posters later that said, racism exists here too, something like that. And so out of that came a need for having some more presence, counseling presence, and outreach presentations. So we did one on, what was the presentation? We did one on students who, law students who did alternative spring breaks, and we're doing a lot of social justice work. We were providing them with resources and support to do that kind of work, because these were law school students who didn't have any background in working with more disenfranchised communities. What else? We've done some outreach projects at the Markaz Center is our Muslim student community center. So someone developed what they call chai chats. And so students, it was like a drop-in hour, and chai tea was available, and it was an opportunity to engage with the community. And so out of that, our discussions are happening, our presence on campus becomes more visible, we become more approachable, and so students can then, who are from marginalized communities, then do reach out for more mental health services. Basically, most of the social justice outreach projects have increased accessibility to more marginalized communities. The Native American community is another group as well. So those are just examples of some of the services.
Mary, Dr. Bolton asked, what process do you use for reviewing those policies for unintended racist issues?
So that's not something we've started. That's on our list of things to do.
Okay.
for next year. Yeah. So if I have anything to share later on in the next few months, I'd be happy to.
Okay.
One of the things that we did was actually have our trainees review our brochure and our training manual to identify any areas where we could edit what we presented to be more anti-racist and inclusive. You know, I had places in the training manual that I hadn't caught that still said he/she. And so we were able to take those out. It was a really simple fix, but it was meaningful.
Lots of good ideas on the chat. Exposing folks from who may not have had as much experience with underserved populations to participate in different kinds of projects or outreach activities. Someone had asked earlier, we had a discussion about what do you do about your students that get arrested for social justice protest? And this is more for the directors of clinical training out there, because the students have to identify, or they're asked to identify, any previous prior arrest. And a couple of us responded, well, that sounds like a badge of honor on one hand, but on the other hand, it could limit their opportunities at federal placements or other job opportunities like prisons or VA even. But social justice, there's lots of people out there marching, and most of them aren't getting arrested, and people do want to participate.
So it sounds like this is an issue for disclosure, with sites being specific also about what might disqualify trainees and what background checks or investigations might reveal. So just something to think about in your public materials.
Yes, we ask programs to identify what they've done for COVID responses. We should ask them what they've done for social justice responses.
Yeah, and I imagine this issue will come up more and more as we get into the fall election season. I had an intern who actually asked me, he said, Clady, you know, is it okay to be involved in protests at March? Because I recognize, I'm an employee, and I represent the university. And I could also see as we get closer to November, there being more political participation, if you will. And so I do think it's important that we communicate with our interns and fellows, kind of if there are any limits to what's expected of them, especially when we also have COVID still going on. And so people do put themselves at risk. For any folks that have folks coming on site, might you have to quarantine if you're outside.
Thanks, Clady. That's helpful. Any other responses to this question? I think there's some good opportunities going on here. I think that people are thinking a little deeper than they may have ordinarily. So this is a great time for change. I think that's about the end of my question here. So we'll move on to this next area here. We were going to talk about what resources would be helpful to you at this time. And some of you have reached out in the chat and asked a few questions. I don't know if we've caught all those questions. I'm sure we haven't. So please feel free to email or contact us if we have missed something here, and apologize for that. These things go quickly and they're kind of broad, sweeping. But many of you have already put in some really great ideas about what you do to raise sensitivity or address social justice. And we'll see if there's other ideas you might have.
And we encourage you to email us if you have policies or reading lists or recommendations for seminars that we are happy to review and to post on the APPIC website. in our section on resources for training directors.
Yes, you can review those training resources at appic.org. And some of those are dated, so please feel free to submit some of this newer stuff. We have a section in there for diversity that we've just recently started to identify specifically. And there's just a few resources in there, so we're always looking for more.
And feel free, if people don't want to speak up, feel free to just type in the chat resources that would be helpful. And that way we can, keep our, kind of keep that on the radar of things that we can cultivate or curate or potentially develop. So please do chime in that way if that's more comfortable.
I rarely worry about the people that come to these seminars. I worry about the people that don't come to these seminars. So that's why we want to put all this on our website so people, when they have the opportunity, can go and review this and see what additional ideas. I haven't seen very many letters from APA that says, you're wonderful in diversity. Thanks for doing a great job. So a lot of the ideas we're hearing today, I think that could be utilized or adapted to your own training program.
Well, I do want to thank you all for doing that. I actually have started sending out to the faculty, all of the internship faculty and the residents in our program. I send out links to the things that you guys have posted on APPIC, reminding them that APPIC is actually being responsive and thinking about this stuff and putting out those resources to them. So when you guys collect them, I send them out to as far as wide as possible to share with our faculty so that hopefully it's pervasive throughout, because it is hard given how many things that everyone is doing and how fast things are quickly changing, trying to disseminate information. But even in email, it's an overwhelming system where people get flooded by email. So, but I think every little step can help. So thank you for doing that.
Thank you. Here's a few of the resources listed on for today's topic here. Again, this is not a lot, but there's some helpful things here that you might want to consider. Shona, did you want to say some additional?
No, I mean, we're happy to start to post more on our website. So some of the suggestions from today's call have been really wonderful, and we would love to have those materials if you'd be willing to share them. I'm wondering also if people have diversity seminars that they've run, and if you'd be willing to share syllabi for your diversity seminars. We could create some sample seminars on the website, and that might be another option too, just in terms of thinking about being thoughtful about the curricula that we have in place and how those might be adapted and updated for the current climate.
Hi, my name is Miguel Ibarra. I'm the fellow training director for the San Antonio VA, Audie Murphy VA. We have quite a few things that we do that I think are very helpful. We have an entire section of diversity training or discussion for supervisors before we start the training year. We have a multicultural potluck to start the training year that the students actually kind of organize. We also have an immersion program where the trainees and some staff come together and go to different parts of the city to look at how San Antonio is so culturally diverse. There's this robust kind of approach to the didactic piece, the experiential piece, and trying to get as many people involved in those different communities. How they interact, what they're looking for when they come to the VA, whether it's a rural community or some kind of cultural background that might be different from others. And so they kind of get in there and actually go out into the community as much as staying here. In relation to what we were just talking about, we have a multicultural journal club because for some people there are different topics that are important And so they get to pick the articles, the topics that they want to discuss, and those journal clubs happen once a month. And so it's kind of a part of what we try to do to keep everyone engaged, but also let them have some say in the direction of those conversations. Just wanted to share that. Thanks.
Thank you. One of my former trainees.
Yes.
Does anyone have questions that we didn't raise in the themes that we identified? And so please, we have about 7 or 8 minutes left, and we would love to answer questions or respond to issues that we think are important for us all.
I would like to say something that hasn't been raised. If it has, I may have been snoozing during that part. But where I am the internship training director is northern Wisconsin. It is, let's see, the diversity, whether you hunt or fish or farm, that would be the extent of the diversity. I think that there is, you know, diversity here, but it's a really hidden population, and probably not surprising because you can still see pickup trucks with Confederate flags, and it is a very, you know, I mean, the color is pretty similar, you know, from person to person. So I think that our internship program has been really working very hard to get diversity in the set of students. And I just recently took over as director, and I went back and I looked at some of the past students. So I do know that they are attracting students from diverse walks of life. However, you know, getting them to stay is really difficult because of the community. And then I know the state of Wisconsin is very much dedicated to it. I read through all of their materials, and I saw some of the ways that they're trying to hire and to draw in, like, you know, putting ads all over the nation for, we call them youth counselors. It's a correctional setting, but they are, we actually refer to them as, yeah, they're correctional officers, but it's youth counselors. So yeah, so people come, but they don't stay, of course. So I've really been troubled by this question of how you go about changing a community. You know, I have an idea just on my own, but I would just love to hear some ideas on that issue that I didn't hear. There you go.
This is Miguel again, and that is a very important question to me. I went to the University of Wisconsin-Madison for my doctoral work, and I remember being told not to go up north. I'd been go to the Apostle Islands in Lake Superior, but was told, bad idea, don't go. I was shocked, I was disappointed. There was a lot of hurt that was rolled into that, knowing that just the color of my skin would, you know, get people to protect me in that forceful way. My questions, when you're asking your questions, are how do we bring people into an environment like that is not yet different, not yet inclusive or accepting, and, you know, how do we take care of people that might be the first few people to come in and introduce that diversity? But I think it's a great question. I think it's a bigger issue. I think it's acculturation. Actually, I'm thinking about that word in reverse. It's the culture of the community that can give a little bit of itself away in order to bring other people in. But I think that's the hard part. So great question. It just gets me thinking back to the experiences that I had while I was there. Thanks.
I'm just reflecting on what a hard question that is. You know, I live in the Bay Area. I grew up here. It's incredibly diverse. There's certainly pockets of unfriendly places, but I don't know what that's like. And to incorporate diversity into an area where it's hard to do that. And I certainly, as a woman of color, avoid certain parts of the world because it doesn't feel safe. So I can appreciate the earlier sentiment that it's a huge question, and I'm not sure exactly how to answer that because I don't know if I have the answers. I find myself in an environment where I push boundaries, but it feels safer to push boundaries than it probably does in Wisconsin. So yeah, I wish I had an answer for you. I would certainly be open to strategizing with you, you know, individually, but right now, yeah, nothing comes to mind about how to tackle that because it's bigger than you.
I know I'm going to be the third to chime in, but I'm going to say the same thing. First, giving it voice, and I think doing exactly what we're doing here, right? Consulting with people who have ideas, suggestions. You can't do it alone, right? Like it's one person against a culture. I mean, you can. It takes a lot of work to do one person against a culture. I think what you're doing as a training facility, though, is you're training the next generation. So in some ways, to always try to figure out, it can feel very lonely, can feel sometimes overwhelming. I too live in a very blue state with very progressive people, so I feel very lucky, and I have lots of ability to consult with people. But if you are finding it difficult to consult, it's trying to find your networks to consult and then try to carry it forward and know that there is no one answer, right? We're talking about systemic changes. These are changes in systems that we have grown up with and are sometimes not even aware that we participate in some ways. So I think in lots of ways, the fact that you are coming to this and thinking about this and asking and continuing to find networks of people who will help you do that. And I think that's what this group is. That's what I was excited by this group, was to keep doing this. So I'm hoping that throughout the year and moving forward, we continue. This is what we have made the commitment of, is we make this a priority in both my research lab that I'm in and the internship program that I'm in and the department level that I'm in. Everyone is committed to it. Now we're just trying to, how do we keep it and then put it in a way that it becomes a habit, right? Like in anything else, like we train people, like this just needs to become a habit. And when we have it as a habit, it'll just come second nature. But it is hard to do when you are the person. But I too will help you in any way that I possibly can, because I know how that must feel. And so thank you for sharing that with us.
The one idea that I did have was to put together some sort of email to the mayor and see if I can get, you know, an audience with the mayor to sit down and just talk, because I think it's an important issue. The world is becoming more diverse, and I see that it's a benefit to I live in the very tiny town that's very close here, and I see that it's a benefit to, you know, there's dying towns, and we are a correctional facility up here who serves African-American, primarily African-American and Indian youth. You know, it seems like it would be a no-brainer for, you know, one of the biggest, you know, companies basically that can hire to say, we want to take a look at diversity. How do we go about doing that? And maybe that mayor is just waiting for somebody like me to come along and go, I want this to be an important issue for this town, you know. I'm not from around here. I've lived all over the world. So I find, yeah, I do sometimes find it stifling for myself as well, but I really love my job. I really love, you know, the population I work with. So I kind of want to stay here. I just would like to see it be a little more colorful.
Thank you everyone for joining us. We so appreciate your presence and your participation. We're going to continue to offer events like this through the summer. The next event that we have planned on the calendar is virtual recruitment and selection. And that is a webinar. And there's a sign up on our website. It's going to be on the 10th of July at 1 o'clock Central Time. And then through the summer and the early fall, we have several webinars on the new and improved APPIC that will be offered at different times. So thanks again, and we look forward to seeing you soon.
Thank you, everyone.
Thank you. Thank you, Jeff, Shona, and Allison.